Hello, everyone, and thank you for joining today's conversation on managing driving with Parkinson's. I will be giving a brief introduction in just a slide or two, but I did want to give a quick overview of what we'll be talking about today. So we will be identifying some challenges that you may face with driving, explore early interventions in driving rehab, including some assessments that may be completed, some adaptive strategies and techniques, discuss approaching the topic of driving with individuals with Parkinson's. And at the end, we'll also go over a brief case study that helps you have a little more insight into something that happened in the real world. So I am Kelsee Hove. I am Director of Clinical Education at Des Moines University in Iowa. I have been an occupational therapist for around 13 years now. My clinical background practice is specifically working with individuals with brain injuries and neurological disorders. I have been in the academic side of things for almost 8 years now. I was always interested in learning more about driving rehab. And when I was working in the clinic, I found that we had several individuals that we would love to address that with, but we just didn't have the education and the programming. So I pursued some further education through the University of Florida. I took a driving rehab certificate course through them. And that's kind of how I got started. And so once I was in the academic world, I helped the clinical site that I used to work at start an outpatient driving rehab program. And being in academics, I like to stay up with all of the research that's being done on this topic, which I will be sharing about in this presentation. I also would like to introduce Michelle. She is not with us on this presentation, but at the end of it, when I share the case study, that has come from Michelle, who shared with me some examples that we could use during this presentation. And Michelle is a certified occupational therapy assistant at On With Life in Ankeny, Iowa. All right, so we will get started talking about why is driving even important? I think we all know that driving allows us to have a lot of independence, to make sporadic life choices, to engage in all of those activities that we enjoy doing throughout the day. So we know that it's a very important topic. And in the field of occupational therapy, we classify driving as something called an instrumental activity of daily living, or we call it an IADL. So it's within the scope of practice for an occupational therapist to be addressing driving. And that's why a lot of the times in driving rehab settings, it's an occupational therapist that is addressing that, but it's not all the time. I will be sharing some different research throughout this presentation, like I mentioned. And so first, I just wanted to share that in one study, there was a survey of individuals with Parkinson's, and it was asking about their view on their driving ability and how that impacted their life. And some of the main categories that were reported were it impacted potential employment, socializing with others, the cost of transportation if you were looking into like alternative uses, and then just the ability to make those spontaneous life choices like wanting to go to the movie or go meet friends or whatever that may be, and the ability to do so. We also know that Parkinson's disease is the fastest growing neurological disease. During the Global Burden of Disease study in 2021, this was kind of discovered, and it was also predicted to continue to increase by 112% by 2050. And that is globally, not just here in the United States. So as we know, it's a very important topic to discuss, and it's also very important to further know how to address this going forward. So there's three main components that I like to break down driving into. So we have to use our vision to be able to drive, our cognition or our thinking skills, but also our motor skills as well. And with Parkinson's disease, we know that all three of these areas may be impacted by the disease. So it's important to make sure that we understand what that looks like and how we may be able to address that. We also know that because driving does require so many different systems, that it's so complex. It doesn't always feel complex when we're driving, but it is one of our highest cognitive functions that we engage in. So it's really important for us to make sure that we're looking into the safety of that. And we also know that driving requires us to process information quite quickly. And we also know that Parkinson's can impact our ability to process that information. So now we'll continue to talk a little bit more specifically on how Parkinson's can specifically address driving. So when we talk about the motor movements that it takes to drive, we think about motor planning. So if I need to put my hands on the steering wheel and be able to move that side to side, I have to motor plan to move my head back and forth to look both ways, my feet to control gas and brake. So we think about all of the different motor movements that are required for driving. And then we think about how those motor movements may be impacted by Parkinson's. We also can think about things like posture that may be impacted. So if I have a really forward posture and I'm trying to, see out the window in front of me, how that may impact the safety of driving. Range of motion as well. Later in this presentation, I will talk about some adaptive ways in which we may be able to address some of these things that I'm talking about. When it comes to vision, we know that oftentimes you may experience dry eyes. And so that can be like a symptom or a side effect of medications. And so making sure that we look into those things if someone is experiencing double vision or even having a hard time moving their eyes back and forth at a quick movement. So we know when we're scanning our environment while we're driving, we need to be able to scan that quite quickly to look for potential hazards. When it comes to cognition, there's a lot of involvement with cognition, and we'll continue to talk about this as well. So concentration, being able to keep our focus on the road, our memory, so remembering, where are we going right now? Which way should I turn? And then, of course, multitasking. So if I'm driving and I know that I'm getting hot and I want to reach down to change and put my air on, that my mind is now directed towards something else than potentially the road. And someone with Parkinson's may have a harder time diverting their attention kind of back and forth to those things. We also want to be mindful of medication side effects. So when we think about each of you, or we all have medications for something, and we want to be mindful about knowing how can those medications potentially impact driving. So one of those might be fatigue. Maybe if I take a medication and it is causing fatigue, that I have to be mindful about the times I'm driving based on that medication. So maybe I am fatigued without medication, and I know that I need to plan my driving around when I take that medication. We also know with Parkinson's, there can be kind of on and off times or increased fatigue. So making sure that we're paying attention to that. This next slide, it shows you just a quick website. So drugs.com is a great place to go to if you're not sure of what all side effects your medications may potentially cause related to driving. So you can go there, you can type in your medications, and it can give you kind of a list of those side effects. I will also note that throughout this talk, I have a few different links, and those are all going to be included at the very end. We have a QR code, and we'll also put a link in the chat once I get there. So that can take you to all of these resources at the end as well. All right, so I will go into talking about some of that research I was mentioning, because we know that it's important to talk about that, and we're thankful that there is research out there related to Parkinson's and driving specifically. So there was a study done that looked at individuals with Parkinson's, and then it also was comparing that to individuals who did not have a diagnosis of Parkinson's, or they call those the healthy controls. And so they had these individuals engage in driving tasks both on the road as well as with the use of a driving simulator. If you're not familiar with what a driving simulator is, I like to describe it as kind of like some computer screens all in front of you. You're sitting in what feels like an actual chair or a vehicle chair, and you have a seat belt, all of those things, a gas and brake, and you're simulating driving. You're just doing this in kind of a virtual way. So that's what it's referring to there. And the individuals who had Parkinson's and were engaging in this research were always evaluated when they were doing well. So if they were having an off day or medication changes, things like that, it was not included within this information. So what it found was those individuals who have a diagnosis of Parkinson's committed more at-fault safety errors, and specifically the areas I have listed here. So those are lane observance, and what that means is just being able to stay in the center of your lane. So maintaining your vehicle between the lines, adhering to stop signs, thinking about intersections and roundabouts and managing those, hesitation before turns. We especially think about if we're going to make a left-hand turn and we're having to, caution for traffic that may be coming towards us, and difficulties with kind of managing that time of when to do that. Not accelerating to the proper speed. So because sometimes there are a little bit of delayed reaction times, sometimes it takes longer to get up to speed, which can potentially be a hazard. If we think about like going onto an interstate or a freeway and how we usually need to speed up quite quickly, and if we were not doing that, how that can be a concern. Lapses of concentration while driving, decreased awareness of how driving affects others that are on the road, and then overall just having more speed variability. So you might be slowing down and then speeding up and slowing down and speeding up. So that's what the research found when it was looking at kind of these two groups, those with Parkinson's and those without. I like to break down the cognitive part of driving. So I mentioned that this is a really big part of driving. We also know that we may not always think about Parkinson's being or affecting our cognition, but there is a lot of correlation to that. So it's important that we understand like how that is and how that impacts driving. So when we break this down, this is called Michon's model of cognitive functions used for driving. So we think about some of our skills that are at our strategic level. So our really high level executive skills, this may be like choosing the route that we're going to drive that day or how long it may take us to drive that route. Then we also have to use our tactical level skills. So these are going to be very high level executive skills like our working memory, being able to adapt our following distance when we're following traffic in front of us, adjusting our speed based on traffic conditions or speed limits, and then also our operational level. So this is thinking about how fast are we processing all of this information coming into our brain while we're driving. It can also impact our ability to keep our vehicle within the lines or reacting to obstacles, pedestrians, things like that. So we know that with Parkinson's, cognition can be impacted, like I mentioned. So some of those most frequently reported cognitive impairments may be the attention and executive function skills, which, like I just spoke about on the previous slide, driving requires a lot of those high-level executive functions. Then it also requires a lot of those visual spatial abilities, and then also our psychomotor speed. So thinking about how quick we react, how quick we can move our eye movements to find things on the road. So with Parkinson's, we also know that symptoms can appear very early, oftentimes early as in before we may even have a diagnosis. Some of these things may start happening. Sometimes we just put things off as this could be age related, which it potentially could be, but we want to just be mindful, and specifically with Parkinson's, these areas and making sure that we're really taking a look at those to know how they're impacting driving. And we know that it's not just one of those areas that's required for driving, but all of those areas are required for safe driving. Now, with driving performance, we know that Parkinson's is a slow and progressive disease. So it makes it really difficult to know when may driving be unsafe for me. So in a sense, it might be nice if we said 5 years after diagnosis, you should no longer drive. But that's just not how it works, considering that everyone progresses at a different rate. Everyone may present with different impairments. And so it's important that each individual is looked at specifically. Oftentimes you go see your physician and it may be a shorter period of time that you're meeting with them, but they're also oftentimes the ones who are determining if you can continue to drive, if you should no longer drive. And so that's why it's really important to make sure that we have individuals out there that can do a more in-depth assessment and then give that feedback back to the physician to have a better insight in knowing if we should or shouldn't, or if we should be modifying our driving behaviors. So there is a need to continue to research what screenings, maybe even potentially physicians or others could do as well that can help predict if you would pass an on-road driving exam or not. That takes me to the next part of driving assessments. So I will speak to some of the research based on that. So when someone goes in for a driving evaluation, what that will include is some in-clinic assessments and then on-road assessments as well. So when you come into the clinic, oftentimes we will be looking at vision first. And I like to point that out because every state has their own law in what vision is required to maintain your license. I'm from Iowa. I know that we have to have at least 20/70 vision in at least one of our eyes in order to even have a license. So if we have issues with acuity or things like that, we know that first thing is first, we need to go to optometry or ophthalmology to have that further looked at. Then we're going to look at cognition. So especially that cognitive processing speed, knowing how important that is for driving. Range of motion of everything that it involves to drive. What does our reaction time look like? Can you get in and out of a vehicle okay and put your seatbelt on? Can you show us how to use the vehicle? Things like that. And then once you are on the road for the driving portion, you would want to show that you can do parking. Research can show that just being able to park and then back out of a parking space is one of the more complex activities of driving, especially if you're in like a mall parking lot or something like that. So you probably will be showing that, being able to maintain your position in your lanes, and then looking out for hazards that may be coming about throughout the drive as well. When it comes to some of the clinical side of assessments, I like to point this out and talk about some of this, not for you to walk away and say, now I know exactly what all of these things are. But my overarching point of this is to show that when you go in for a driving evaluation, sometimes the clinical tasks that they have you engage in can feel silly or like, how does this have anything to do with driving? And in fact, there's a lot of research that correlates your performance on some of these clinical assessments directly correlate with the skills it takes to drive. And so I like to say that up front, knowing that it can feel frustrating if you don't maybe score very well, or you feel like, why does, connecting dots or things like this have anything to do with driving? So it's really looking at those skills required to drive. So the research has shown that something called the trail making test, there's a symbol digit modality, a useful field of view, or a block design. They're all pretty quick assessments to be done in a clinic. They're really good predictors of a strong correlation with driving performance, specifically in those with Parkinson's. And if you think about it, a lot of these quick assessments are looking at those things like processing speed, reaction time. And those are the areas that could be negatively impacted from Parkinson's. So we want to have a good idea of how you're performing with those before we just get in a vehicle and do an on-road drive. The trail making test specifically has consistently shown in the research to be the best like independent predictor, or if there's going to be one assessment, that is the one that can predict the best of like safety errors during distraction of driving. So this is just really helpful for clinicians to know that the research is out there and there are specific assessments that can help give us better insight. We also know that disease duration is not correlated, or not a reliable predictor, I should say. So if you have been diagnosed for 20 years, you may still be fine driving. You could be diagnosed for 2 years and not be fine driving. And so that's why I highly encourage and let individuals know that this is a very individualized assessment, and it's not outlined by years or how long you've had it. And this is just further outlining that the rapid pacewalk is another one that's a reliable predictor of passing an on-road test. So we can't generalize this to, of course, everybody diagnosed with Parkinson's, but it does provide a lot of great guidance for those individuals who are doing those driving assessments in the clinic. I also like to point out that there was a consensus statement on driving that was published in 2014, and it kind of has 3 main points to it that I'm going to briefly discuss. So they use something called the Unified Parkinson's Disease Rating Scale. You may be familiar with it. You may have had that taken on you, but that's what it was using to predict this. So those who scored with a mild motor disability and then did not have other like risk factors happening with Parkinson's may be what we call fit to drive. So the recommendation is, if you fall within that category, the recommendation is to still have a driving assessment to have a good baseline. Knowing that Parkinson's is a progressive disease, we want to know where are we at now, and is this something that is progressing that we need to now address, maybe a new problem that's happening. Then consider having those evaluations done yearly. And we say that because it is progressive. So if you are someone scoring more on that mild motor impairment, you may do fine when you have a driving assessment, but we do recommend you come back and do that again in a year. And we also say from the very beginning to start planning for not driving. We all know that day will come eventually, and the research shows that the earlier we start addressing driving in Parkinson's, the longer actually someone ends up driving. And part of that is being prepared for some of those changes that we might need to make with modifying our driving or our time or how we do it. So just keep that in mind. And then, of course, thinking about alternative transportation options, knowing that we may have on and off times. And so even if we are still driving, there may be times where we resort to alternative transportation. The next one is for those who scored in the severe motor impairment category. So anybody who scored that on that assessment was actually recommended to no longer drive, report to your state licensing agency to no longer have that driving license, and then address, how am I going to get around now? Then you may be wondering, the third one is everyone that's in the middle, right? That moderate group or the middle group. So that is the group where it's kind of tricky. It's kind of hard to know what to do. So that's why they strongly recommend to have that comprehensive driving evaluation, and then starting to provide strategies to transition to non-driving. If we're in that moderate group, we know that we're obviously getting closer to having severe impairments. And so we really need to start planning, and maybe we start just slowly reducing our driving so it's not just a sudden cutoff of driving. And then develop a plan for what that may look like. There was also a randomized control study that looked at the impact of Some of those systems within our vehicles, or we call them the in-vehicle information system, or IVIS for short, or the advanced driver assistance system. So a lot of vehicles nowadays have those in them. And so we're thinking about, I mean, are those helpful? Are they not helpful? And what it shows is that if you're using your adaptive cruise control, for instance, that it can help you reduce those speeding errors, like I mentioned earlier, of speeding up and slowing down. Bradykinesia can be correlated with errors when those systems are not being used. It can also have correlation with if you have memory impairments, and then thinking about driving errors when you have those systems activated. So we also know that it can be both a good thing and a bad thing, depending on what impairments you're kind of dealing with. So if we have memory declines, we know that sometimes technology is not always helpful and it may be more distracting. So just being mindful of that. If you're not sure what your vehicle does, there's a website it's mycardoeswhat.com or org, I can't quite see it. But I have that on the resource page. And so if you go to that website, you can type in your year, make, model of your vehicle, and it'll tell you what all of these features are you have in your vehicle. And maybe you don't know how to shut them on or off, and it can help you with that as well. So driving rehab steps, first, we always say, get a referral from your physician. Now, because I'm from Iowa, I'm going to speak on Iowa laws. Every state is different. I wish I could speak about all 50 states, but I will give an example of Iowa. In the state of Iowa, we require a physician assistant, a nurse practitioner, or an optometrist to be the one who sends the letter to the DOT if you want them to stop driving or continue driving. Which is kind of funny because a lot of times the one that is evaluating individuals happens to be occupational therapists. Not all the time, but a lot of the time. So if I do a full evaluation on someone, I need to be able to send that information back to someone who can then report that to like our DOT or your driving license agency. So that's why we always say we need that referral. So we have someone else to send it back to. Then finding a driving rehab specialist. In a few slides, I will instruct you on how to find one. Then once you find one and make an appointment, you'll go through what I mentioned earlier, where you go in and do clinical assessments. And then if things are looking okay, then you would move to the on-road assessment. All in all, it's usually about a 3-hour time period. And then you come out with an outcome, right? So is that person good to keep driving? Everything seems okay now. Maybe they recommend you come back in a year. Maybe they recommend that you need modifications to your driving, or modifications to how much you drive at a time or where you drive. It might be recommended to come back for further interventions or to stop driving. And then I put there again in bold is to remember to repeat that driving assessment, knowing that this is a progressive disease. So using driving simulators, I mentioned those earlier. It's a safe way to be able to maybe practice without having to actually be on the road. And so using a driving simulator may be one way that if a clinic has one of those, that you can go there and practice some of the things you're having a hard time with. And maybe you come up together with some compensatory strategies that you could utilize and practice it there before you then go practice it on the road. So there has been studies that do show practicing it on the simulator can then carry over with improvements of on-the-road driving as well. Of course, individualized plans of what those strategies may be are going to be dependent on what impairments you're dealing with. And then a collaboration with your entire medical team. So we want to know what medications are impacting that, and maybe other therapy team members as well. So if we have to think about approaching stopping driving, it's a hard conversation, right? And so here are a few things that I recommend. One of those is through the, let me get to the the National Highway Safety Transportation. They have something called a driving transition education. It's a really large PDF that you can kind of go through. It's like a course that you can take. Sometimes something like that may be helpful for individuals. Making sure that we know what are the requirements in our state to be able to continue to drive. Just because you have a diagnosis of Parkinson's disease does not take away your license. Like I said, every state's different. In the state of Iowa, it talks about having a loss of consciousness. So if that happened to be something you've experienced, then oftentimes they would say to stop driving for at least 6 months, and physicians do need to report that. Physicians do not need to report directly to a licensing agency just because you have Parkinson's. So I just like to point that out. I know those questions often get asked. Then looking at what are the alternative transportation options. Some of us live in rural areas. So do we have family, friends, other people that can help us out with that? The research recommends that you make a gradual transition. So not just cold turkey stopping unless you, of course, are very unsafe and we need to do that immediately. But if we know and plan for it, oftentimes we end up driving longer because we can make modifications to that. They also recommend having a buddy system. So maybe you do have public transportation. Instead of trying it for the first time by yourself, find a friend, find someone to go with you to try some of those things out. And then another recommendation is actually maybe you do stop driving, but you keep your vehicle. For some people, just getting rid of that vehicle feels really hard. So maybe you want to keep it. So you ask people to come over and drive your own personal vehicle, and that makes you kind of feel a little more at ease with potentially giving up driving. This will also be on the resource page, but this is a research-based tool. And this would be for those who have witnessed someone's driving. So this would be, let's say you have Parkinson's and you have a significant other who often drives with you. That other person who's witnessing your driving would go and take this online screening. It goes through a series of questions that's going to ask what you perceive of that person's driving. And at the end, it lays out different categories of like, maybe this is kind of a red flag, or you kind of fall into this yellow area of here are specific areas. Maybe it's reaction time, maybe a variety of areas, and you can print out those results and bring it to your physician or bring it to your driving rehab specialist, because this is a research-based tool. It's specifically researched in adults 65 and older. It doesn't mean you couldn't use it with someone else, but just a nice tool to know maybe how to start looking at things. This is also, I know you probably can't really see this, but this is an example. This link is also in the QR code of a driving planning agreement. So through AAA, they provide this document that you can print and sign, and you could go over all of these details where it basically talks about, I know that eventually I will need to stop driving. I can pull this back out when it comes to that time, and we've agreed that this is what needs to happen. So sometimes it's just nice to have something like that to help guide those conversations. Another QR code that will also be in the resource page. This takes you to a website that will help you find where your closest provider is to do a driving rehab assessment. Something called ADED, it's the Association for Driving Rehab Specialists. There's an area in there that you can click Find a Provider, and then you could just put like your state, and it will give you a list of all of the individuals who provide driving assessments, where they're located, and like phone numbers or emails for them. So that would be where you would go to find where is your closest provider. Now I'll go over a quick case study. So this case study is about Mark. Mark was an 82-year-old or is an 82-year-old male, Caucasian, and we're going to go over kind of his quick episodes of care for driving rehab. He has a diagnosis of heart disease, peripheral neuropathy that was diagnosed in December of 2022, and then was later diagnosed with Parkinson's in 2025. So on this slide here, it lays out what his episode of care looked like. So the first time he came to OT, he was not yet diagnosed with Parkinson's. But he was having issues with the feeling in his feet and the neuropathy, things like that. So he had an OT evaluation. He was feeling a little hesitant with driving, so they worked with the driving simulator and they tried some different braces to help with the lower extremity, and then gave some recommendations for that and also tried those on the road. So then he was still driving. Then he came back a second time and had another OT evaluation. He was starting to feel a little off. He had recently been diagnosed with Parkinson's. So they tried the driving simulator, and what they ended up finding out is that because of his neuropathy and Parkinson's, that it wasn't really safe to drive with his feet anymore. And so they started trialing hand controls. So instead of controlling gas and brake with your feet, you can do that with your arm. So they trialed that on the simulator. They talked with physicians. They were able to prescribe to get some of that equipment for his vehicle. And then he started trialing the behind the wheel trials with the occupational therapist, as well as working on some in-clinic assessments as well, and that driving simulator. And then continued training with the new use of the hand controls, and was able to go back to the DOT or the, wherever your licensing agency is, and passed an on-road test with the use of the hand controls. And so it just gives an example of someone who's kind of like started seeing for driving rehab and then would come back to address like new things that were coming up or be reassessed with those. So overall, some things that you might look for with driving and changes specifically with Parkinson's is having the slower or varying speeds, hitting both the accelerator and the brake potentially at the same time, and that's a new behavior you're noticing. Having slow reaction time, so really slamming on the brakes last minute rather than a gradual stop. Potential near misses or like almost getting into an accident. Potentially getting lost or confused where you're not sure where you are, and then finding that you have poor attention or fatigue. So when looking specifically at all of these, we know they can be correlated with Parkinson's, and we want to make sure that we address those. And I also like to mention that just because you're noticing some of these things is not a for sure that you can't drive. In fact, like I said, the research shows that the sooner you address it, the longer you usually end up driving. You may be able to make modifications to medicine or times you drive or places you drive in to help that. So with Parkinson's and kind of what that looks like for driving rehab, if you have a diagnosis, we immediately recommend those therapy evaluations, collaborating with the entire team of healthcare providers, then maybe trialing some adaptations to see if they help improve driving, and then try those behind the wheel, and then continue driving, of course, would be the goal if appropriate. Here are a whole list of some references, and then here's that page I mentioned. You can scan that QR code if you're not familiar with QR codes. If you have a cell phone with a camera and hold it up to that, it should bring up a link. And if you click on that, it's just a document I've put together with those helpful links that I've mentioned throughout the presentation. I'm also happy to answer questions. My email is listed here. Michelle's email is also listed. She does a lot of the on-road and in-clinic evaluations here around Des Moines, Iowa. And with that, I believe we will now have some time for questions.
Thank you, Kelsee. That was such a lovely, thorough presentation, and we've had many questions submitted by our audience. So the first question we have is from Kent. He has asked, should all the tests be done on a yearly basis, especially the costly driving assessment test?
Yes, that's a great question. And I hadn't brought up the cost of it, so I can speak to that really quick. But yes, we would recommend all of the tests, just because all of those tests are looking at all of the areas required for safe driving, and knowing that those can be impacted with Parkinson's, we would want to go through all of those. That being said, a lot of places require out-of-pocket costs for the driving, especially the on-road portion, because insurance does not like to cover that. But some places do cover the in-clinic portion of it. And so it just depends on where you go. But unfortunately, that is one downfall to it, is having to reoccur that cost each year.
Absolutely. So I also have another question that has come in from Chris. He has asked, how should we modify our driving to reduce the risk of accidents?
That's a great question. It's a broad question for the fact of that really depends on what impairments that you're dealing with. So maybe I can give some examples. If you are dealing with fatigue and you notice that that fatigue happens a lot more in the afternoon, one of the first things we recommend is modifying your driving times. So maybe you only drive from 9 a.m. to noon. Maybe you feel that you're more easily distracted, and so you avoid urban environments or interstates, and you stick to more rural or closer to home places. That would be an example of that, or just collaborating with the healthcare team to work on whatever that impairment is. What can we look at to help modify?
Thank you. That's great advice. And the next question here is from Kurt. He has shared the concept of doing activities with intent can improve performance, such as driving. Kurt has shared that he found that driving with intent has increased his driving safety. And he asked, do you also use this approach or recommend this approach to increase driver safety for people with Parkinson's?
Absolutely. That is a wonderful point. So if you're not familiar, what they're referring to is really focusing on the task. I think in the world we live in, we're constantly distracted by things. So everybody should benefit from intentional driving, but especially if you are dealing with something like Parkinson's, where it can impact, that distractibility or visual motor skills, things like that. And so really having more of like a mindful focus on the task. And some of that can be done in the clinic, because we kind of have to teach our brain, like, how do I stay focused on this one thing? So absolutely, I would highly recommend that.
Great. And my next question sort of builds on his point on attention and intent. Someone has asked, please share tips on how to maintain attention and be prepared for unforeseen occurrences when driving. And they added specifically, does listening to the radio affect attention when driving?
Yes, that's a great question. So I would like to say that for me personally, I think listening to things keeps my attention, right? But if we have potential cognitive impairments or distractions, we would actually recommend to not have other things playing in the background. So if we're already having a hard time trying to focus on the task of driving and staying, our attention on the road, we don't want to add in other sensory input like auditory input from someone talking or a radio or things that can take our brain away from that. So that would be taking it away from that intentional focus. So I would not recommend adding other things in for that specifically. And I think the first part of that question just talked about like how to potentially maintain attention. And sometimes that really does come with also shortening our drive time, knowing that maybe our 20 minutes might be our max of driving. And if that means that I can still drive 20 minutes rather than not at all, then that's where we have to start to think about some of those modifications that can happen, but still keep us safe.
Absolutely. Thank you. And someone has asked, this is a question that was submitted prior to the event today, but they said sometimes when they drive, their foot shakes and they think that it happens when their meds are running low or they feel anxious. And usually they don't have far to drive. They've asked, is there a fast acting medication that I can pull off the highway to take? Have you seen this in any of the Parkinson's individuals that you've worked with?
As far as like experiencing that like shaking, yes. Now, the specific medication I won't be able to necessarily speak to. I would recommend asking a physician about that. I think that there is a direct correlation, though, to timing of the medication and specifically making sure that we're taking the medications that help with that. Other times, people will notice that that is worse when they're fatigued. And so sometimes that just may only happen later in the day, or if you've done something strenuous before driving. And so it may be more of a collaboration of timing, and then collaborating with a physician on specific medications. I just unfortunately can't speak to a specific fast acting one, but you could talk to your doctor about that.
Absolutely. Someone here has asked, are there any mechanical or assistive devices available that might make neighborhood or limited driving safer or more possible for people with Parkinson's?
Yeah, and if I understand that correctly, I think they're referring to like mechanical differences within their vehicle to allow them to continue to drive. That would be like the example I talked about, like a hand control. That would be considered a mechanical adaptation. So if you are experiencing a lot of trouble with lower extremities, but maybe not so much with the upper extremities, there are different ways to adapt. Maybe you have a harder time with range of motion. We have also like extended mirrors. There's like seatbelt extenders. There's lots of like little features that you could utilize to change some of the mechanical parts of a vehicle to continue to drive.
Yeah, absolutely. There's so many changes happening too with newer cars and newer safety features. And someone from the audience has said that. They said they have an electric vehicle that has several self-driving features that they use. Do you have any thoughts about potential safety issues using those features or anything to look out for?
Yeah, I kind of mentioned that previously, where a lot of times those things can be helpful, but there are times when they may be more distracting than helpful. So that's going to be a really individual basis on what's helping. Those are things that you would talk about in a driving evaluation and actually trial, potentially on the road as well. So you may find that a cruise control or, a lane assist. A lot of vehicles will either vibrate or bring your steering wheel over. And if you find that that is helpful for you, then of course we would want to recommend using it. But unfortunately, there's not like everyone with Parkinson's benefits from this or that. So it's really what helps you and what may be causing more distraction for you.
Yeah, absolutely. Absolutely. Because there are so many screens and buttons and things to touch, and it can be a little overwhelming for some
Yes.
people. So I have a comment here from Wendy, and she said her neurologist and physical therapist have not brought up driving safety with her yet. Is that common? And what would you suggest for her to have the conversation? Bring that up with her neurologist and OT. What do you think?
Yeah. I mean, I absolutely recommend bringing that up, knowing, especially if you are currently a driver, and knowing just in general the impact that Parkinson's can have on driving. Sometimes it's not brought up because there may not be someone anywhere near there that does driving evaluations. So sometimes people are not as familiar with the actual services that are out there. And that's when I would recommend going to that ADED website to find where is your closest one. But I would absolutely bring it up, knowing that, you're not only wanting to look out for yourself, but everybody else on the road around you as well. And they might be able to give you some recommendations or referrals of people who do specialize in that area.
Absolutely. And another question that has come in is, how do I help loved ones or even friends in a support group understand that it might be time to talk about driving and driving assessments?
Yes, that's a hard topic to approach. I had listed a few things throughout my presentation that may be beneficial on like guiding the conversation. through AAA, they also have resources about talking about driving and potentially driving cessation. So that's one way to go about it. There was also that contract I showed an example of. So you may want to do that like very early on, to talk about the conversation when it maybe doesn't feel like this is suddenly happening. And so I can speak to like the research, and it shows that the sooner you have it, usually the easier it feels on both sides. So of course, I always recommend approaching it with empathy, compassion, trying to think if that was me and someone was asking me if I should still drive, how defensive I might feel about that. So being really mindful about, how that's approached, and then maybe having some of those resources available to help guide you through that.
Absolutely. And I do want to add, just as a follow-up to that APDA has an episode of our Unlocking Strength Within series that actually talks in a lot of detail about how to have this conversation with the loved ones in your life about driving and alternative transportation options and how to access alternative transportation options. And Kelsee, we've had a few people ask in the comments if you can pull up the QR code again. They want to use it.
Yeah, if they bring that last slide back up, it should be there. There you go.
Thank you.
You're welcome.
And so someone else has asked, how will I know it's time to stop driving? And I know that's something you touched on at the end of your presentation. Can you just sort of recap some of those points? Because I think that is really top of mind.
Yeah, absolutely.
For a lot of people.
Yeah. So some of those areas that I think I was bringing up earlier, I was just clicking on, there we go. So sometimes we might know of course, if we've had a recent accident, or especially more than one accident, if you've had a loss of consciousness or confusion where you feel like you get lost often, those are kind of my first go-to, like we really need to think about maybe stopping driving. But otherwise, just being really familiar with, do I speed up and slow down a lot? Do I almost hit vehicles a lot? Do I have a hard time parking and backing my vehicle? Just kind of attention and fatigue. Do I find that I'm falling asleep really quickly? Those are all going to be kind of my big red flags to at least have an assessment done and further dive into that. The initial thought is an accident, of course, like an at-fault accident would be my first thought.
Absolutely. So I think that for this next question, I don't believe this was something that you touched on in your presentation, but in your experience working with people with Parkinson's, is it safe to drive after DBS surgery?
I can't speak for everyone, but have people continued to drive? Yes. And I would highly recommend, if you have something like that, like a surgery, a big change in medication, anything like that, to have a reassessment, even if you've already had one done, because there are now new ways to adapt and change things. So we want to make sure that we look at that, because you may present very different than you did prior to having the surgery.
Absolutely. So a couple of people have commented that they're experiencing some visual changes related to their Parkinson's. Someone said that their depth perception seems to be impacted. Is this common for Parkinson's? Should people see an ophthalmologist?
Yeah, absolutely. It can be common to have those visual changes. So yes, my first recommendation would be to go to ophthalmology, because they're going to be able to take a look through the lens of kind of the neuro side of things, or the neurological side of things. To do that first, to see if there's any recommendations from their end. And then if you do come to a driving assessment, you already have that information. Otherwise, the first thing we're going to say is you need to have an assessment done by ophthalmology, and then we'll move forward. So I would recommend that first. But yes, that can be common. Yes, there are ways that we can work on compensatory strategies, modifications for that, and changing just our driving behaviors.
Absolutely. And speaking of compensatory strategies, do you have any thoughts on compensatory strategies for anxiety when driving, where
Yeah.
people are feeling nervous when they drive and that makes them, that just makes them feel really ill at ease while they're driving? Do you have recommendations for that?
Yeah, absolutely. That can be very common, especially after knowing that you may potentially have difficulty in certain areas. So, with anxiety specifically, I try to do more of like exposure to if it's a certain environment that's causing it, or maybe it's just driving in general. If you have outpatient, let's say, therapy that you can go to address some of those things. Maybe they have a simulator, or maybe you can get in your vehicle and drive in some like quieter locations to work through and talk through what that may be like to address it. I don't have like a perfect answer for it because I know that can feel really hard to experience anxiety. And then sometimes some of those symptoms start to increase when you have the anxiety. But it's definitely something I'd recommend to address and talk to with like your therapy team. And they might have specific recommendations for you and what works for you.
Absolutely. And someone else has just sort of added on that, saying that they are frustrated when they drive in busy communities with lots of traffic and they have to work at staying calm and not becoming anxious in those driving situations.
Yes. So I, again, would recommend if it's specific to an environment like an urban environment or when there's a lot of traffic, sometimes the simple solution is to avoid driving in those areas. I know that's not always possible or not the perfect answer, but if there is a place that's causing more of that anxiety or frustration and we can take an alternative route, even if it takes longer, or maybe have different transportation if we have to go in those areas, and then just keep driving where we don't have to run into that. That's ultimately going to be the safest. And we know that we do need to make modifications to keep ourselves and everyone else as safe as possible. So that's my first thought with that question.
Great. And I think that is all the questions that we have time for today. But again, if you have questions, please feel free to reach out to Kelsee. Kelsee, on behalf of all of our audience members and APDA, thank you so much for sharing that wonderful information with us. Very thought-provoking and very informative. So we are grateful for your time.
Yes, thank you.
And to all of our audience members, thank you so much for joining APDA today for Thriving Through Occupational Therapy. And we look forward to seeing you in August for our next episode of this webinar. We have many other wonderful programs available on our virtual calendar of events and on our YouTube channel. Thank you so much, everyone. I hope you have a great rest of your day.
Hi, I'm Leslie Chambers, the President and CEO of the American Parkinson Disease Association. Each month across the country, APDA is providing support groups, exercise classes, and educational programs like this one to support the Parkinson's disease community. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. If you enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Your gift can help APDA support people living with PD through local programs, reliable resources, and groundbreaking research designed to find treatments and ultimately the cure for Parkinson's disease. Please donate today at apdaparkinson.org/donate. And thank you so much for your support.